Hello, everyone, and welcome to Dementia at Home. My name is Rebecca Porter, and I'm the First Link Support for the Alzheimer Society in St. John, New Brunswick. Today's educational video is going to be about sundowning. You've probably heard of this term, but what exactly does it mean? Sundowning is a symptom that can show up in people who have Alzheimer's disease or other related dementias. When someone becomes confused, anxious, aggressive, agitated, or restless consistently later in the day, usually late afternoon or early evening, this is called sundowning. It is thought that sundowning can be a problem for as many as 66% of people living with Alzheimer's disease or other dementias. It can occur at any stage of the disease, but it tends to peak in the middle stages of dementia and lessens as the disease progresses. Sundowning often affects the person's quality of life, and it can be exhausting for the caregiver. So what are some of the behaviors associated with sundowning? Some behaviors that are typical with sundowning include becoming demanding or aggressive, experiencing delusions and hallucinations. These can be auditory, visual, olfactory, which is smell, touch, or taste, pacing or wandering, doing things impulsively, attempting to leave home, having difficulty understanding others, and having difficulty doing tasks that were done without difficulty earlier in the day. So what causes sundowning? A variety of events or issues can trigger sundowning. These can include being tired at the end of the day. This can lead to an inability to cope with stress. Low lighting and more shadows. This can create confusion and hallucinations, especially with common objects that look different when it's darker. Disruption of the circadian cycle, the sleep-wake pattern, because of the changes to the brain from dementia. This makes it so that the person cannot distinguish day from night. And not having as much or no activity in the afternoon compared to the morning, which can lead to restlessness later in the day. Although the symptoms of sundowning cannot always be eliminated, there are some things you can do to alleviate the symptoms for the person with dementia. Finding a way to respond to sundowning may take trial and error. Every person is different and may react differently. Here are 10 tips to try to avoid a sundowning episode or to lessen it once it has started. Tip number 1, see if the behavior is being caused by discomfort or a need. This can be hunger, needing to use the toilet, pain. Pay attention to nonverbal cues. Tip number 2, allow for rest and naps between activities, but try to limit too much daytime sleeping if possible. Tip number 3, avoid making appointments, bathing, or other potentially stressful activities in the late afternoon or evening. Tip number 4, prevent overstimulation from the television or radio, which can lead to increased confusion. Tip number 5, provide adequate lighting to lessen shadows when it begins to get dark. Tip number 6, brisk walks or other forms of physical activity throughout the day may reduce restlessness or the need to wander later. Tip number 7, keep the person active and distracted when sundowning may occur. For example, preparing dinner or setting the table. Tip number 8, allow quiet time if this helps to decrease agitation. Tip number 9, familiar routines may help them feel more secure. They can include readying the home for evening, closing curtains, turning on lights, or bedtime routines that include warm milk and soft music. And tip number 10, change sleeping arrangements. For example, adding a comfortable chair to the room, a nightlight, or leaving the door open. Other tips include restricting the amount of caffeine and sugar the person has in the morning, maintaining a regular eating and sleep schedule as much as possible. A rocking chair can provide stimulation while also having a calming effect. It may be helpful to keep a daily journal to pinpoint the causes of sundowning symptoms and see which strategies help. This can also be a great tool to provide other caregivers or persons part of the healthcare team. If things do not improve, it may help to have the person evaluated by their doctor. Doctors may recommend certain medications to ease the symptoms. For example, antipsychotics, sedatives, or sleep-regulating hormones such as melatonin. These can help some people, but because many have serious side effects such as dizziness, sedation, causing sleepiness, or dependence, it is recommended that other options be tried before relying on medications. Talk this over with the doctor. Sleep kits are also a great therapeutic tool to use at nighttime to promote calmness. Contact your local Alzheimer's Society for more information on sleep kits. For more information on hallucinations and delusions, please follow the links provided below. If you or someone you know are in need of more resources and support, please contact your local Alzheimer's Society at 1-800-664-8411. This has been Dementia at Home. Take care and be well.